Now more than ever, innovative technologies are fueling change and sparking new ways of thinking. Collaboration between corporations and startups is key to staying at the forefront of these trends. However, finding the right startups can be expensive, time-consuming, and ineffective. But Plug and Play is here to help. As a corporate partner, you will gain access to a whole ecosystem of innovation. Discover startups that meet your tech interests. Stay updated on the latest trends and network with industry peers. We will help you during every stage of your innovation journey, no matter where you are and where you want to go. Get in touch today.
Hello and welcome everyone to Plug and Play Health's first webinar of 2023. My name is Jennifer Thomas and I'm Managing Director of Plug and Play Health. And today we're going to be discussing how new diabetes care empowers the consumer. All right, great. Let's get right to our panel. So I'd love to welcome to the stage now our panelists. I'm so excited to have Olivia Chung. She's Digital Health Innovation Lead for the US. For Roche Information Systems, and also Dr. Betul Hatipoglu. She is the Director of Diabetes and Obesity Center from University Hospital. Welcome to you both. So great to have you. So let me begin with a few introductions. Betul, I'll begin with you. You've worked as an endocrinologist for many, many years, but you currently hold many positions. You are Professor of Medicine at Case Western Reserve University School of Medicine. You are Vice Chair at the University Hospital System Clinical Affairs. You also hold the Mary B. Lee Chair in Adult Endocrinology at University Hospital's Cleveland Medical Center. But tell us a bit about your current role as Medical Director of the Diabetes and Obesity Center now that you're focused squarely on these important issues.
Thank you. Thank you for having me today. Because diabetes is such a pandemic level in the world and huge alarming numbers in our society as well as in the United States, it has been a pleasure to focus building diabetes care not only within UH system, but focusing also about population health. And I really love and enjoy that part of my new job.
Great, that's fantastic. It's so nice of you to join us today. I know you're busy, you're even seeing patients today. Olivia, so you've worked in health insurance on value-based care and virtual care, kind of in the early days of developing the approaches to new patient experience. You even helped establish Chief Experience Officer position. In addition, you've been a practicing certified dietitian for over 20 years, specializing in cardiac, diabetes management, and other chronic conditions. So now that you're squarely focused on healthcare innovation at Roche, tell us a bit about your current role.
It's exciting, and I've been telling folks that I have the coolest job on the planet. So till this day, this is still a true statement. Thank you so much for the warm introduction. So with the clinical practices and the value-based payment program that we established, we have been seeing a very common theme is that diabetes and blood sugar management, that has been one of the top 5 most expensive medical cost expenditure across the country. No matter which state or which zip code that you study in, it's always one of the top 5. And so it's exciting to be in my current position because we are bringing that experience, the observation and the clinical evidence, and then bringing the latest and greatest startup and technology together and offering the best intervention. So it's exciting and it's just so wonderful to be here.
Great, thank you so much. And it's been such a pleasure for us to work with you as well. So let's start out with the positive. Let's start out with what is working in diabetes care. And Betul, if you could please lead us off there.
Of course, I have been in this healthcare business, if you want to say, or patient care area for more than 25 years. And I can tell you what totally transformed the way we are able to treat patients, our continuous glucose monitors. Some of that technology just entered into our clinical care, and everything was just a new way to look at it and to take care of. So
sorry, I got myself on mute there. That's so great. And and kind of as a follow-up, can you lead us off with a little more about this transformation? What were patients seeing before? What can they see now?
Yes, before, diabetes was a silent killer. There was nothing they could feel. There was no pain. The blood sugars didn't really cause any alarming findings in them. So for patients, they felt fine. But seeing the invisible was absolutely transformative, but with the way they were looking at their disease, the way they could take it seriously and proactively change their behavior, proactively and actively take their medication. So it wasn't just about me telling them, hey, you got to eat healthy. It was about them seeing really they needed to eat healthy.
Right. And you even mentioned an example about what eating a piece of bread does.
Yes, even sometimes in some patients, a cup of blueberry can shoot them up to 250s. A slice of bread, and don't even talk about pizza.
All right. So it's good to know. And then Olivia, from your perspective, how it has affected not only a patient, but provider, caregiver, sort of these new developments.
Wonderful. I'm going to kind of like continue as what Dr. Betul said. So just like what she said, we, not just the patient, but the family, the network that's supporting the patient, the technology become an enablement and empowerment to them. Because way back before all this application, if someone with a really poor control, diabetes, diabetic condition, if they're given a referral to a clinical dietitian or outpatient dietitian, they might have that interaction once a month or maybe every other month. The access point wasn't quite that sufficient. And so we don't even know what the patients are doing, when they left the doctor office or when they left the education session. And oftentimes the patient back then didn't know what to do, right? They're not going to make another doctor visit just because they're feeling dizzy. So with all this application and technology, they have everything at their fingertips. And so, and with the AI and Safer, I'm going to bring this up, Lark, which is one of the Startup Crispy alumni. Thank you to Plug and Play. What's so unique about that capability is that they're not only giving them the education to the caregiver and the patient, but is actually very culturally competent, meaning that they have that education and dialogue in many different languages. So it totally breaks a lot of barriers, right? If they need something, they can speak their own languages, access to the education that's familiar with them. So that is a lot of exciting part for the patient and caregiver. And as you can, tell from what I just shared with you, that also improves the health equity problem. When it comes to provider, it's brilliant because it created multiple access points for them to collect the data and allowing them to be more equipped at tracking the patient's status, right? And I remember in my previous life before joining Roche, I was actually supporting multiple specialists, and we're in the room because the patient had that patient monitoring, and we're able to see the blood sugar trend at that patient home, even miles away. And when we see there is certain area, time that doesn't look normal to us, our care team immediately reach out to the patient. So that is another type of empowerment that we are giving to the provider with all this type of technology. And with the new trend of value-based, Jennifer, you mentioned it, that is also allowing the provider to not only reporting the accurate data to the payer, but also to show the payer that, they are doing everything that they can to making sure that the patient is successful. So on the insurance side, allow the payer to have a closer look to see if this particular intervention can have a more complete financial impact to the patient population, right? This is not just fee for services. We are able to see that, if we apply certain, interventions or AI consultation, that actually saving the patient from going to the inpatients or emergency room. So that is actually a win-win for all the party in the ecosystem.
That's amazing. It's such good news too. Dr. Betul, I just have another quick follow-up question for you on that. Since there has been so much sort of advancement already, is that advancement available to people like maybe those 1 in 5 who don't know they have diabetes? Like, is that available now?
No, I mean, this is such an important point you're bringing up, because I personally think those are the individuals should also have access to see the impact of everything. So the invisible for them should be visible. However, currently, many insurance companies won't really reimburse or pay or cover these for pre-diabetic. Even until recently, they weren't paying it for fully for all the diabetics. Many insurances will only give it to patients who are on insulin injections, not even people who are not on insulin therapy. That's a huge, great point that I think we need help.
So we do need to make some progress more with pre-diabetics.
Correct. Or diabetics who are not on insulin yet.
Right. Absolutely. Good point. So now that we have some of these developments, what do you think is going to bring us to the next level, Betul? I'll start with you.
Absolutely. I am so excited to see the advances in artificial intelligence and the algorithms and programs, because there you are now in the next step. Next step where not only you're seeing the sugars and patterns, you're telling the person what needs to be done. And that's also extremely important. As a physician, I see them, and Olivia, for example, with your team, every 3 months the most, maybe once a month, perhaps, if you are lucky and have an extended team members. But the patient lives with it 24 hours a day, 7 days a week. They don't have a vacation from it. And some artificial intelligence that is actually already working to replace what I would have done if I was with that patient 24 hours a day, is the next step that excites me the most in this field.
That's awesome. Can you give me an example? Maybe an inpatient and outpatient example.
Thank you, Jennifer. We have, for example, currently available FDA cleared glucomender, which is an inpatient intelligence of providing input and proactively telling the providers to decrease the insulin, change it, or give more, so that hypo and hyperglycemias are prevented as much as possible. So that is, for example, an exciting. The outpatient setting, our smart pumps, insulin delivery devices, especially the one that is coming out now on studies, which is fully automated, even can tell from what the patient is going to eat and how much insulin the patient needs. And they are in phase 3 trials. The bionic or islet, they call themselves, is dual hormone, 2 hormone insulin pump, is very exciting. And we have a type 2 program that I am involved, that I'm looking forward to using it, which is WellDoc, which goes with insulin, outpatient, and medication, and somewhat lifestyle interventions. So those are really the ones that I am aware of right now that can be used as an embedded algorithms that uses some kind of an artificial intelligence, but more is needed.
Yeah, fascinating. What about the bionic pancreas?
Bionic pancreas is what they call islet. I am so excited about that. That is almost mimicking, if you don't count, which we have tons of new ways with stem cell therapy, which is very different pathway and very different. But when it comes to technology, bionic pancreas, which is islet, they call themselves, is closest we can get with the technology to a natural pancreas. Very exciting.
Predicting the next meal. Right? So it's really a combination of like lifestyle, data on lifestyle, medication adjustment, glucose adjustment, a constant feedback, and collecting all this data to make smarter choices. That's great. Olivia, maybe from a macro view, can you tell us what you think will get us to the next level?
I think there are a couple of things that on top of my head. I think Dr. Betul mentioned several times about the care continuum, right? So, not only equipped the patient with the educations and kind of like supplying them with the right information, planning the meal, what they need to do during the day, right? Or do exercise. But there's another part that, the doctor is getting all this data. So I think the next phase is like, how can we put all this point of care together, right? How can we create the adapter or integrator to put all this together so that the provider will know the whole story of the patient. And on the patient side, well, probably folks here been hearing about social determinant of health, health equity, right? So not only getting the clinical information from the provider, but the patient will also understand that, the zip code that they're living in or the demographic factor that they are, being impacted, what kind of additional tools or information that they can receive so that they can continue to monitor their lifestyle or blood sugar from a social economic point of view. So those are the things that, kind of we're looking into this day. And I think not only just a life science company looking into it, but I think every member of the ecosystem is interested in how can we put all this, stitch all this together to create that holistic view.
Earlier, you mentioned that that some of the developments has allowed for value-based care. Can you give an example of where value-based care is actually being realized?
Wonderful. So value-based care might be a foreign term to a lot of folks, but value-based care in US actually implemented, established more than 10 years ago. So it's a shift of the way we pay or compensate provider from fees for services to looking at population health management, right? And like I shared with the folks here earlier, diabetes has always not just one of the top 5, one of the top 3 most expensive medical condition that every party want to, look into and have some kind of control to it. So when it comes to value-based care, when it comes to provider, oftentimes provider are given, if they're participating in value-based care, they're given a population to manage what we call attributed population. Oftentimes more than 50% of that population are diabetic patients. So the provider need to come up with different intervention that can apply and to say, for instance, care coordinator, they have to think of what kind of intervention, what kind of digital tools that they can give in to the patient so that they can monitor the patient from a remote setting. At the same time, the payer will probably need to find a way to collect the information so that they can monitor the financial impact. So that is how it worked for the past 10 years.
Interesting. And, not to predict which is going to be the solution that will really work, but it sounds like it's more of a platform play in that instance to really understand the larger population.
Correct. Okay. And don't forget social determinant of health. All those factors are, that's it, transportations, like do we have enough support network around that patient? That is also things to consider as well.
Right. So it's not just managing your personal health. It's how do you access the care? Where do you live? How do you get there? So many more pieces. So given all that, maybe Olivia, I'll continue with you. When do you expect to see changes, or when do you expect to see sort of either the incidence of diabetes going down or the management of the disease improving so that it is not one of the top 3 costs of chronic care?
I think it will be an ongoing, but here is the light of this, right? With the technology that I think the doctor here mentioned something really important at the beginning of the panel is that not only we have the technology to managing it, which I think is we're getting, quite a lot of cost saving from a lot of study, but we are also having this tool to allowing us to identify pre-diabetes, right? So while we might be able to control the chronic condition, but we also are having the tool to identify more folks that are at risk at pre-diabetes. So I think when it comes to preventative care, I think we are doing well. I see that we still have room to improve. Again, it's about access to care. The more folks, the more providers, the more patient understand and be able to provide it with all those digital interventions. I think the better. I hope that's answer your question. I know it's a long answer.
It does. And then what about this government issued playbook on social determinants of health? How does that, and the regulations around that, how does that play a role?
So maybe I can share that link to the team here so that Plug and Play can publish. And I think about 2 weeks ago, the federal government has issued a social determinant data playbook, and the targeted audience or everybody in the healthcare ecosystem, the payer, provider, and also health technology entrepreneur. the hope is that while we are creating digital tools to, benefit the patient or collect the data, the government kind of give us the framework about what kind of social determinant of data that will be helpful to manage the population. And they also kind of give us some guideline and recommendation when it comes to data integration. So that will be some good element for the entrepreneurial, for the warrior soldier here to consider how we can integrate all this to benefit and make that ecosystem more efficient.
So sort of establishing a pathway.
Yes, that would be a good way to put it together.
Good. And Dr. Betul, what do you think, if you look inside your crystal ball, how many years are we looking at before we see some improvements, whether it's again, the reduction of incidence or the increase in management?
I expect, because of availability more and more of this technology to many socioeconomic the disadvantaged even individuals. Nowadays, we cannot get them for those patients who are needing it the most. I expect we are going to get much better in the next 5 to 10 years the most. With AI and those embedded programs will be more and more available because they are already reality. And we are going to shift the way we treat these patients. However, COVID, the pandemic, which was in a way a gift for medical field as well as a curse. This happened in both ways for diabetes patients as well. It increased the numbers of diabetics for different reasons. However, it also pushed everybody, all of us, to use technology to the fullest possible way. So that was an alarm bell that ringed, and everybody was waking up and using what we had available, and perhaps pushing us to move even forward.
And if I could dig a little deeper into that, why the increase during COVID? Is it just that people weren't moving as much? What actually happened?
It's a great question. It's a mystery. Indeed, our NIH has a huge initiatives that we will be hopefully part of that to understand what really happened. Yes, it was maybe COVID-19, 19 pounds that everybody talks about, perhaps being depressed, losing jobs, maybe not availability of a healthy lifestyle. However, there is a huge increase unexpected in children and adults of type 1 diabetes, which has nothing to do with all those. So we know that COVID as a virus infects everything and everywhere, and pancreas is not an exception. It infects pancreas. I think we will learn a lot more with these studies in the next 5 years.
And is that study supposed to come out fairly soon to really understand how COVID impacted the pancreas or other organs?
Yes, we are. We will find out if the NIH, which centers are going to be involved in March this month. And then we should have an outcome study around 3 to 4 years. So we won't know for another 3 years.
Got it. And just quickly, maybe something we didn't address in the beginning, with all of these sort of digital tools that are coming out to assist diabetes patients, is there a difference between the tools that assist type 1 and type 2 diabetes patients?
Oh, yes, absolutely. So some of them merges though, some of them are the same. If type 2 is long-standing, they end up needing diabetes medication and insulin fully. So they will use the same technology as the type 1 who will be using the closed loops and continuous glucose monitors and smart pens and so forth from the beginning. Type 2s might need it a little bit later. Lifestyle modification, exercise, and diet changes are much more important for type 2, especially at the beginning of the disease, and prevention of the disease. So they are different. However, there is an overlap. So any advance for any of those diseases will help both population.
Got it. And then quickly, I want to ask you some advice too. So just for context to the audience, Plug and Play works closely with university hospitals and Roche, and they both have really robust innovation capabilities in-house which are very impressive and have worked with entrepreneurs for quite a while. So let me go back to you, Olivia. What advice would you give entrepreneurs as they're developing these tools?
How much time do I have?
Just a few minutes so we can take a couple of questions. Go ahead.
So real quick, it's about, can you demonstrate it's a care continuum? One thing that I learned throughout my life working with different startups or new application, are you showing me a feature or are you showing me a product? I think there's a difference between feature and product. So the more you can show me that you're helping me to connect the dots and able to do data integration, able to connect the data that you connect with the electronic medical record, the less that we have to do, the more that you can show it to us, the chances are much better.
Great. Thank you so much. And Betul, how about you?
Yeah, I always say if you're producing a product and you want someone to use it and a physician to understand, you have to have them involved in your process so that you get their side as well.
Right. Okay. So make sure the patient and the physician are there. Thank you so much. This has been truly enlightening, and thank you so much for your insights. We do have a couple of questions. I see, Dr. Betul, you answered a few there, but I want to maybe drill down on the first question that Lewis had about, this continuous monitoring similar to heart monitoring. And you said, yes, it actually would be helpful. How would that work? What kind of device would you wear?
So I think if they can, and there has been some in the past and still work on a non-invasive blood glucose monitoring systems. We had it 20 years ago. I remember one kind that was, it was like a little watch, and it was sucking the fluid from the wrist area and reading it. It was very exciting. However, it didn't work the way we thought when it was prescribed to the patient. It caused rash and things like that. Yeah. But it is possible, non-invasive way. There are ways that one can try to do it. I believe very strongly, like you said, Jen, before people develops diabetes, if we could have them see it and stop it right there and then, that is our goal. If early in the diabetes, you can put the diabetes into remission so it doesn't come back, that is there. These devices should be really used. Yeah.
Right. And I know we have, I think, an example of that with one of our startups coming up. Great. Olivia, anything from you on that? Continuous monitoring? I mean, Roche is, very interested in diagnostics. It's what you guys do very well.
Yes. So continue as what I share, right? We're looking for, product that, show us the data integration, giving us the whole head to toe, right, as a cohesive care network around the patients. I think that's pretty much what we can think of at this moment. Again, giving us a product, not just a feature. And if the product is targeting the patient, making sure that this product is user-friendly, but also showing us as a companion of the patient.
Got it. And then just another quick question, maybe this is for the pre-diabetic patients. What do you recommend for increasing engagement? We can have all the digital tools in our back pockets, but if the patients are not engaged, that determines their outcomes essentially. That gets to the SDOH answer. What would you say about that? That's
why I think we have to really have user-friendly to produce something that people are going to use. We need to have people involved. How they are going to use it. Is this really something they can use it? The engagement piece is one of the most struggling part for physicians and healthcare providers today as well. How do you engage the patient? How do you get them excited about something? And that is making it more attractive, easy, available, cheap for them, and they will see the value. And maybe that comes as a direct to consumer, right? Rather than having to go to your doctor, you're just hearing about it. It's something as easy as wearing your watch. And, you're already got insight into your glucose levels. Great. Olivia, any comments on the engagement piece that you've seen or?
I think from a product point of view, the entrepreneur or the product manager need to be creative. So things like assisting someone to do grocery shopping or giving them the recommendation for what to purchase in the grocery store, right? That kind of data can also predict someone, eating habits. So that kind of thing, you might not think directly, oh, this is a diabetes management tool, but it actually a segue, an entry point to understand someone's patterns.
Right. So food as medicine.
There
Awesome.
was a question, Jennifer, if you want to go
Sure.
back to it. I think it was an important question. I couldn't type too much.
Oh, sure, please.
It was about how do you think about the importance of diet changes that are sustainable and vegetarian diet. And I actually wanted to say that I personally find as human beings, we are so diverse culturally, ethnically, even as age, right? For someone who can do a diet at 20 years old is not the same for someone who's 60 years old. I am not fan of one kind of diet. I am very much open to all kinds of diet, whatever works within, of course, limitation of healthy diet, like a Mediterranean diet, vegetarian or not, doesn't really matter. Whatever the patient can do is more important.
Great.
That's what I wanted to write, but it was too.
Thank you. No, that's fantastic. And if you do stay on and more questions pop up, feel free to answer. But I want to thank you both for your time and your insights. It's really been valuable for us, and we really appreciate it.
Thank you
so much.
Pleasure to be here.
Now I'm going to pass it over to my colleague, Aya Hamden, and she's going to take over for the startup presentation. She is our venture analyst at Plug and Play Health. Take it away, Aya.
Thank you, Jennifer. Hi, everyone. Excited to be here and to continue on with the startup presentation. So the way that this will work, we've got 3 great startups, and they're going to give a 5-minute pitch each. After each 5-minute pitch, we'll allocate 2 minutes for Q&A, and we'll also put a poll up for the attendees to indicate whether they would like a direct introduction to the startup. So we're going to go ahead and get kick-started with Una Health. Una Health is the most effective digital therapy to reverse metabolic dysfunction based on mobile tech, biosensors, AI, and behavioral science. With that, I will go ahead and pass it off to Dominic, who will tell us more about Una Health.
I'm co-founder and chief product officer of Una Health, where we are building the future of metabolic health. I studied neuroscience, and since then I've spent my time building and delivering digital products for people with type 2 diabetes globally. As the first employee launching and scaling a product across sub-Saharan Africa, then at the UK scale-up Babylon Health led type 2 diabetes efforts, launching products into the NHS in the UK and the US. Now, type 2 diabetes solutions globally are failing. This is a condition that can be managed and even reversed through diet. Yet over the last 20 years, diabetes has tripled globally. Now, why do current existing solutions for nutrition related to type 2 diabetes fail? One, we know that people respond uniquely to food. You and I could eat the same sandwich. It could be okay for you, but bad for me. If we don't have this degree of personalization, then solutions are either generic and not effective or highly restrictive. Think ketogenic diet. It's not accessible to everyone, and even for those that do manage to do it, find it very difficult to maintain this kind of restriction. Finally, it's a silent condition with wrong biomarkers tracked that lack reinforcing feedback to enable behavior change. How can I know that this change I made 3 weeks ago to my breakfast is causing the change in my weight I see today? Whether my 3-monthly HbA1c value changed because I did not exercise last week. Without this prompt, it is very difficult to initiate and maintain behavior change. But there is a solution to this, and this is what we're building at Una. Our vision is to reverse metabolic dysfunction through precision nutrition and lifestyle management. We want to do this for the 3 billion people affected by metabolic dysfunction, not just those with type 2 diabetes. So we're seeing more and more evidence emerging showing that many conditions are caused by the same underlying physiological challenge, which is related to insulin resistance. You can manage blood sugar excursions, and you can manage insulin resistance and reverse these conditions. And we're seeing things ranging from obesity and type 2 diabetes, which are a bit more well known, to Alzheimer's, migraine, fertility. It's a number of conditions that are emerging, and we see ourselves as building a solution that tackles these conditions for everyone. But we're starting with type 2 diabetes. So how does it work? So combining biosensors, particularly continuous glucose monitors, and artificial intelligence, we develop a deep understanding of our users, both their individual preferences, but also their unique metabolic profile. Once we have this understanding, we can deliver the most effective lifestyle recommendations. And effectiveness is a combination of how relevant this is for the individual to their personal preferences and habits, but also the most effective, so the highest efficacy, where it will be the most effective in terms of improving blood sugar excursions. And then we need to create the right environment for change. And our behavioral change journey enables users to build great habits gradually that are maintained in the long term. And the feedback loops here are incredibly important. Since building for the last 2 years, we've been running and validating our program. And the results that we've seen have been fantastic. At 3 months, we show a best-in-class HbA1c reduction of 1.1%, beating companies such as Livongo, Ramada, and Aviva. But also we see that this is sustainable. So at 3 months after completing the program, 69% of our users are still within disease reversal. Crucially, people still love our program and find it easy to do, with the vast majority wants to complete it again. And then users continuing to implement the lifestyle changes that we recommend long after the 3-month program is completed. So we are building the most effective, sustainable, and trusted solution for people with type 2 diabetes. We've spoken about effective and sustainability, but trust is a key part as well. Publishing the evidence we've collected, being certified as a medical device, adhering to information security standards is core to our mission and values, but also crucial to enabling us to thrive as a digital therapeutic in the market. Soon we'll be launching this in Germany, where it will be fully reimbursed to the 6 million people with type 2 diabetes under the DiGA scheme now. They will be able to access the product for free, requesting it directly from their health insurance company, but doctors will also be able to prescribe it as if it was a medication. We hope to bring this live in the coming months, and then we'll be running a leading randomized control trial and real-world evidence studies to show the effectiveness of Oona at scale. As we advance the product, make it more intelligent and easier to do, setting us up for condition and international expansion. Just a quick snapshot of the brilliant team and advisors that we have behind Oona, who've experienced launching some of the most impactful, innovative digital health solutions globally. 2023 is already shaping up to be a hugely exciting year for Oona. I can't wait to see what the rest has in store for us.
Okay, wonderful. So next we've got GraphWear. GraphWear's device is designed to diagnose and monitor chronic conditions, and to do so without any need to test blood or urine. Its mission is to make this technology accessible to everyone on the planet. So with that, I'll go ahead and pass it over to Rajatesh, who will tell us more about GraphWear.
Thanks, Aya. Good morning, everyone. We heard a lot about chronic diseases, and effectively we are trying to create a solution here that is non-invasive and doesn't break the skin to get adherence back to where it belongs. Now, this number is pretty critical. There are about roughly 2.6 billion people who suffer from a chronic disease, often multiple ones. We all in this panel or in this call know about this number, but it means that people are going to get a major chronic disease pretty soon if this is not curtailed. And the modern methods to prevent them or to be able to facilitate any recovery is not adequate, and they lack adherence. Now, just deep diving into the chronic diseases, the major chronic diseases are heart disease, diabetes. We heard previously that one of the top 3 is diabetes. So I'm not going to go into details of what diabetes looks like, what it means, but these numbers in front of us are important from the US perspective. There are 2 types of diabetes, type 1 and type 2. Type 2 is developed when you have lack of insulin, when you have insulin resistance. 25.5 million suffer from this condition in the US who have already been diagnosed. And we have around 1.4 million who are type 1 diabetic. And about 200,000 folks of them are pediatric patients. And then we have people who, because they have not contain this disease progression, they have to start taking intensive insulin, and that's the intensive insulin therapy. So this is becoming an epidemic. Now, continuous glucose monitoring, right? Why glucose? Diabetes means that the insulin in your body is not working well or has stopped working. So we have been historically measuring glucose as an indirect marker to see how well is the insulin regulation in our body. But the real problem should be actually measuring insulin directly. We'll come to that later. But in terms of glucose monitoring, it is at the heart of diabetes management. It's super critical. If we are able to measure this continuously, we can prevent the onset of other diseases like cardiovascular degeneration and neurological degeneration as well. The current landscape in the devices out there can be broadly classified into two categories. You have implantable needles that go inside your skin, like from Dexcom, from Abbott, from Medtronic. These are about 0.5 millimeters to 0.75 millimeters long, centimeter long needles that can actually penetrate the interstitial fluid layers of your skin, subcutaneous layers. It was a revolution back in, it started in 1960s, revolutionizing the field. But often what we are witnessing right now is kind of stagnating in its technology. It hasn't broken free to all people out there. Then we have the implanted version, which is the Eversense. Pretty cool tech as well. Lasts for more than 6 months now. So that's pretty nice. But let's look at the facts here. Now, of about 500 million diabetics, we have like less than 5% who have access to these CGMs today. And that's telling something. That's because these tools are very good, but they often lack adherence, meaning people need training to use it. They're often costly. So if you want to make everyone in the planet use this, we have to remove the barrier to adopt it. And that is take away the issue of any wound formation of infection. So non-invasive has been the holy grail in this field for a while. Many have tried it, and GraphWear has cracked the problem. So introducing our product, it's a needle-free CGM. The idea for needle-free, again, comes to the fact that we want people to adopt this easily. This is what it looks like. It has a device, it has a patch. We can mount this onto our abdomen, or we can also wear it like a wristwatch. Right here, I'm wearing one. It's connected to a phone app, pretty much inspired by Dexcom and Abbott, because they've led the way there. So we're sticking with some of the principles that they have brought onto this ecosystem. So it streams real time to my phone every 5 minutes, like a conventional CGM. But what it does is it also gives you an ability to see directly on the screen of the device your alerts. So you don't have to rely on your phone. You can just flick your wrist and you can see your real-time glucose on your wrist. To give you a sense, our performance is comparable to other CGMs on the market. This is early feasibility data. In terms of where we are on path to obtain FDA clearance. We finished our feasibility trial. We have a pilot trial ongoing. The hardest challenge for us is to get the factory calibration, like Dexcom G6 and Abbott Freestyle 2. And that's a hard challenge. So they had 20, 30 years to do it. We have pretty much been at it for the last 1 year, and we're pretty close. But that's what we want to do: get an equivalent pathway as Dexcom G6. And we are gearing up for a pivotal trial very soon. Our team is comprised of leaders who think first principles, who never shy away from a problem, and are not often hooked on a solution, but rather keep focusing on the problem to solve. And we have built the technology to solve this particular nature of the problem we are at it. And we have folks from Dexcom who recently joined us, so that gives us more, we take the best in class and learn from people who have been there, done that. The platform has been validated for other biomarkers. Now, why this becomes important is it's like we're accessing transdermal glucose. So anything on the skin, potentially we can extend it out, our tech to sensing that real time. Now, these markers are of particular interest for us. There's no clear regulatory pathway to these, but they have already been tested. So it's pretty cool what we can do with these. But finally, taking a step back here, this is where we want to go. This is where we are. We are focused on diabetes management, starting with glucose and insulin, but we want to be able to create monitoring for all major chronic diseases with key biomarkers that are available on the skin. They all diffuse out from blood and interstitial fluid. So pretty much 90% of the markers are available on the skin. and the technology can meet those specifications. So we're pretty excited what we can do here. Thank you, everyone. Just feel free to reach out to me if you want to join our team or you want to partner with us.
Thank you for joining us, and we'll go ahead and transition over to the next startup, which is Ciba Health. So Ciba Health offers a personalized digital therapeutics and virtual care platform. They prevent and reverse chronic disease conditions with personalized holistic healthcare. And I will pass this over to Innocent, who will tell us more about what he's building at Ciba.
So Ciba Health is a global digital therapeutics platform and a virtual care platform that it's really focusing on really reversing chronic condition for patients with either type 2 diabetes, digestive health. So what we did here is to really build a platform that's a multi-product, because when we look at what's happening in the space today, there's a lot of shift away from really when I talk about point solution, right? So, and then why is Ciba unique today? Ciba is unique because we have the ability to really research the unique biochemistry of every patient, because what we've seen today in the market in terms of the solution today, it's about a one-size-fits-all. It's about what I call symptom-based suppression. But again, Ciba has this ability to really get to the root causes of this condition and then help the patient to really be empowered and then allow the patient to live life to its fullest. Another aspect of this Ciba today, why Ciba is very unique, is our ability to really guide the patient journey from start to finish by providing what I call the full spectrum integrated care model on the work platform, right? So again, really our goal is to target employers and insurance company, again, because this also gives us a unique advantage that we're able to fight what we call fragmentation in the space today. And that's why a lot of our partners, our clients today who are working with Ciba really find Ciba really very unique. So again, the next slide will talk about our approach. Again, why is Ciba unique? How are you actually deploying the solution today? How are we able to reverse the condition today for our patient today? If you see the slide today, this really gives you an overview of really how we approach it, how we do it, right? If you can see in the middle here, we have a patient in the middle, so we call it patient-centered. So this is surrounded by, we have our health coaches. These health coaches allow, work with the patient, handhold the patient to support the patient, and then their first point of contact for this patient. And then we have what we call the doctors there, who are also there because Ciba is led by doctors, right? Unlike other solutions that you have in the market today, really when they focus on really looking at health coaches and dietitian, but we have doctors because it gives us the ability to be able to communicate, right, with other providers and share information in terms of decisions that we're making. And then while we're making those decisions, our goal is to really empower the patient, right? So if you see here, how do we get to the root causes? Really, we have a panel, what we call the advanced lab panel, that allow us to really dig deeper to figure out what are the root causes, what are the drivers of this condition today. A lot of the focus today is about lifestyle and behavior, but it's another component which we call the biochemical component. No one is actually even looking at that because the lifestyle, the behavior component triggers the biochemical component. So advanced lab allow us to look into that to be able to figure out what are the root causes, what's going on today, how can we better support this patient so that we can put together a personalized health plan that can help this patient reverse the condition. Obviously, we are leveraging cutting edge technology like the remote patient monitoring capabilities that allow us to integrate all the wearables that we send to the patient today, which include the Freestyle Libre that we use for our continuous blood glucose, and that allows us to also integrate the Oura Ring that tracks heart rate variability, sleep quality, rest and heart rate. We also know the importance of sleep really on our metabolic health. So for us, it's very important to be able to track that to see how well this is going and how we can better support our patient. And the other aspect of it, again, we also send our patient the Within scale. This scale allows us to continue to track real time and see how patients, in terms of their weight over time and see how they're improving with that as well. The next slide will talk about again, the patient journey, the typical patient journey for Ciba today, because the question is, how does this even work? The first thing, patient come on the platform, you enroll and complete a very comprehensive questionnaire that asks you a lot of questions about, your past medical history, your family history, medication history. And then the next step is we send them what we call a box with kits in there. So this box contains the Freestyle Libre, it contains the Oura Ring, it contains the Within scale, it contains the blood pressure monitoring curve. So it gives us the ability to really collect that data, and the health coaches really help them to set up the devices, because we also know that our patients that have challenges really with technology. And then so the health coaches are there to really help them during the initial session to set up those devices for the patient, and then they schedule a blood draw. So for the blood draw, the option is either we send a mobile phlebotomist to the patient home, or the patient will start stop by Quest Diagnostic Lab, where we'll probably have the sample drawn. And then once the lab is collected, it's analyzed, it comes back to the provider. The provider will review all that information and connect with the patient. And then after the connecting with the patient, they will provide areas, identify areas where they identify the gaps, where the challenges are. So the challenges are what we look for, like the biochemical component would include inflammation markers. We'll look at exposure to environmental toxins. We'll look at macronutrient deficiency. We know the importance of vitamin D in the mitochondrial function, right? So we look at all that. If there are any gaps, we want to ensure that really, again, the other aspect again is what we'll call insulin receptor resensitization. Our goal is to clear out the inflammation in the body to be able to allow the patient to do what we call metabolic flexibility. We do not restrict patient to any diet, because we know that when you restrict patient to a diet, it's also a problem. It's not sustainable. So with the metabolic flexibility, it's the ability for the human body to be able to break down carbs, fat, and use them efficiently, right? So, and then there's a dietitian that look at all this data and able to really put together a plan that really, really will support your unique your unique biomarker, your unique biochemistry. Unlike saying, okay, you have type 2 diabetes, we want to restrict you from eating carbs or from eating, bread and all of that, because again, every patient reacts differently. So we were able to really continue to track that and provide this personalized intervention that helps you to reverse your condition. And then there's ongoing care and data monitoring using our remote patient monitoring capabilities. So this is a classical dashboard that as a patient and as a provider I see today, because all the wearables that we have today, you're able to integrate all that into the platform. The doctors have visibility to do this. They're able to track real time. They're able to identify, based on our predictive analytic model, we're able to identify those at high risk, looking at the data over time and be able to provide proactive intervention and provide them the support. So you can see here, these are some of the data that actually we integrate into our RPM that allow us to in real time see what's going on with this patient and how we can better support them, right? Again, it's to provide transparency. This also really provide a patient empowerment. It's so powerful because the patient, they're also able to track their trend, and they're also able, because of the trend that they see, where they are today, they're able to connect, again, they could initiate, connecting with our health coaches and say, hey, my data has been trending in this direction. But again, even before they do that, the providers have also seen that, and they were able to really connect with them proactively and see how we can better support them, and if there's any change that we need to make for them, really, because this is so powerful for us. It allows us to really empower patients. It allows us really to be able to really see how we can better support patients by being proactive.
Thank you very much, everyone, for joining today. That concludes our webinar, and please stay tuned for all the future up and coming events that we have. Thank you.